Well, good afternoon, everyone. I'm student nurse Diana Williams Marshall, and today I'm going to do an assessment on a newborn for you guys. First of all, I'm going to wash my hands, gather my supplies, and prepare for my assessment. During an assessment is a good idea, especially if a newborn baby. You can have the mother stand nearby in case if the baby gets a little agitated. She could be there to soothe the baby, or sometimes you could have a pacifier there so baby could be comfortable. The main thing is to keep in a nice calm environment, and the assessment shouldn't take too long because you don't want the baby to get too cold. Let us begin. Washing my hands, and as you can see, I gathered my supplies. I have a pair of gloves, my notebook to write my information on, measuring tape to measure on the baby, my pen light, stethoscope, pulse up, alcohol pads, tongue depressor, thermometer. Okay, all of my supplies are gathered. And now this is my 1-month-old baby, Janie, that I'm going to be doing my assessment on. First of all, I'm going to we're going to be doing a head to toe assessment on this baby. First of all, I want to move my baby's cap because what we're going to be doing is measuring the head circumference and checking for lesions, lumps, and making sure making sure that we test for the fontanelles to see if they're closed or open. So first of all, I have my measuring tape. I'm not going to be wearing gloves at the beginning of the assessment because I shouldn't be in contact with any body fluids. So usually during the first half of my assessment, the head to toe, we're going to just be using our bare hands, and I've already washed my hands. So put the tape on the centimeter side, and I'm going to be measuring my baby's head circumference. Putting it around the baby's head, 10 centimeters, and that I will document when I'm done. Next, I'm going to do, and while I'm at the head, I'm going to gently feel the baby's sutures, make sure they're aligned and the fontanelles are still open. There's a soft spot that is to be expected. Next, we're going to move on to the eyes and make sure they're open and that they're even, symmetrical. And while you're here doing the eyes, you can always use the pen light. Use your pen light to check to see if the baby has can see. So I'm going to shine the lights in the baby eyes, and usually the pupils constrict or the baby blinks accordingly, so you know the baby has some light, retraction to light. After I don't do that, after I already checked the eyes, I can move down to the baby's nostril. You want to make sure that the septum is patent. You're making sure you want to see if the baby could smell. You're going to check the nostrils to see if there are any drainage, and there are 2 holes visible. Next, you can move on to the mouth, and you can use a tongue depressor if you don't want to insert your finger. If I was wearing gloves, some persons use their finger to check to see if the soft palate is present, the hard palate is present. So you gently put it into the baby's mouth, and you check the gag reflex, and you check the palate to see if it's present, and you look under the tongue to see if that septum is present, which it is. After you don't do all of that, you can move down to the baby's ear. You want to make sure these are also aligned and symmetrical. And you could also do what is called a whisper test to make sure, or click your finger and watch to see if the baby follow sounds to check the sensory air of the baby. And also, while you are at the ear, you could look inside the ear with your pen light to see if there is any drainage into the baby ear. And then you do the other side as well to check to see if there's any drainage. You want to make sure, be gentle. Moving down, you're going to check the neck and the shoulders. Okay, we're checking the neck. You're going to check the neck for symmetry and alignment, and you're going to make sure the baby can move her head left and right, and bend the head slightly forward to make sure the baby can move her head. You're going to check the nipple lines to make sure there's two and they're symmetrical. You're going to check the reflexes of the arm, make sure these are aligned properly. Put them over the baby head and make sure they can move. Do a little range of motion to make sure the baby can move those arms. And then while you're down here, you're looking for breathing, the breathing pattern to see. Usually with girls, breathing pattern, usually they use the more of the abdominal muscles. And the respiratory rate is a little faster for babies. The normal values for respiration is about 30 to 60 beats a minute, and the older the child gets, at least around 6 months, they usually start breathing like 25 seconds, 25 breaths per minute. Okay, obviously down on the stomach now. We already checked the nipples for alignment, and we checked the chest. You can also use your stethoscope and listen for breath sounds. For breath sounds while you're here. Make sure it's nice and warm. You want to startle the baby, so you're going to put it on the chest. Okay, you need to listen for your respirations. Now you're going to feel normal breath sounds. And now you're going to check for your baby pulses. Usually check the brachial pulse. And you're going to do this count for 1 full minute, which is 60 seconds. Using your stopwatch, and you count this for 1 second, 60 seconds, and you get your baby's pulse rate. And usually baby's pulse rate's a little faster than the adults, like 100 to 110, 115. Those are normal for a baby at this age. After you done check for your pulses, brachial and brachial, you're gonna make sure your baby reflex, like I said earlier. And while we're down here, you're gonna make sure the stomach is not distended, not distended, and soft to touch, and making sure the baby doesn't grimace for anything for pain. You could also use your tape measure to check your abdominal girth. You're gonna put it around the baby, and you measure your abdominal girth. And those measurements you document on your notepad after you finish. And while we're here, also, you're going to look at the baby's umbilical cord. And by this time, she's 1 month, so this should be dropped. The navel is inward. There's no swelling, redness, or it's healing nicely. Down to the baby. And now, while you're on this area again, you could loose the baby pampers. But you want to take it completely off because the baby could urinate. You don't want the baby to urinate all over here. It's in bedding. So yes, you could just loose the pampers at this time. So we could check okay, we already loosed the diaper like I've said. And now we're checking the legs to make sure the baby can move his legs and make sure no fractures. You do put the legs backwards, downwards. And okay, and also with babies, you know, and adults, they usually check to palpitate to check the capillary reflex. That's the word I want to use. Capillary reflex. And usually in babies, they don't use that. They use the heel, and you just press gently. And it should be like 2 to 3 seconds. Cap refill, which is normal on this baby. Okay, moving right along. Whilst I have my baby undressed and his pampers loose, I'm going to sit my baby up, keeping the pampers in place, and I'm going to turn my baby gently over. And now I'm going to check the back to make sure there's no bruising, swelling. You're checking for spine, the spine, to make sure it's aligned. And make sure if it's aligned and the shoulders are even. Checking the buccal, the hip, make sure it has 2 cheeks. You're going to check the buttocks, make sure there's a line separating the 2 cheeks, and there's creasing at the buttocks. Okay, now I'm going to turn little mama back over, and at this time I'm going to cover the baby for a second so I can put on my gloves so I can assess the baby genital area. Okay, undressing my baby again. We're going to check the genital area. This is a female, so you're going to make sure she has a slit in the middle, opening for passing of urine, and 2 folds. Okay, I'm dressing my baby's back. After you do all those assessments, your vitals and all those other things, and making sure all the examination, you can fasten your baby's pampers to make it comfortable, make her comfortable. Dress your baby back, swaddle her back in her clothing. Okay, you put on your baby's hat, make your baby comfortable, get the pacifier, pacify the baby if it's fussy. If not, just make the baby comfortable. You can ask mommy to come to be with the baby. I'm gonna discard my equipment, take off my glove, wash my hand, and I'm gonna document. I hope you enjoyed my assessment.